Okay, I'm back again on Brett's Brain Blog. I think I'm going to stop doing that. It's so cheesy and it's irrelevant. You know what this is. If you're watching this, you know what it is. I've come to the conclusion today, just based on the number of times that I've found it necessary to record a video, or to write in my journal, or to throw on all my clothes and get all my stuff together and sit on the edge of calling an ambulance. It's getting to a point where this overwhelming feeling that something is horribly wrong with me and I can't cope with it. I can't reduce it in any way. I can't make it ease off enough to calm down for more than 30 minutes at a time, and even then it's misery in between these episodes. Shit's getting bad, okay? Right now I'm having one of those really super agitated times when I feel like I'm gonna die. I mean, it's not like a panic attack or an anxiety attack. It's like a storm of emotions, like just intense, overwhelming emotions that are surging so quickly that you can't even identify what it was. Like, you try to pick it out, like, is this fear, is this anger, is this sadness, what the hell is it? It's everything all at once, like assaulting my brain, and simultaneously it's like severe agitation to the point that, like, I need something to calm me down because I cannot do it myself. I don't necessarily mean medication, but something's got to give. Like, I only have two options. I can either call my mother or an ambulance right now and see if a hospital can help me, or the only other option is to sit here and hope to God that this does not get worse and that it eases off on its own. But that's my existence right now. That's, the primary reason I'm making this video is to see if it will calm me down. But secondary reason is so you guys can see this is what I'm living with. This is not an anxiety attack. See, check it out. I'm calm. That's not the point. This is not anxiety. This is not panic attack. This is not, like, right now my heart rate maybe 70, 80. It's not like that. It's like something is so bad wrong inside my head with my perception, and it's agitating me so much that I feel like I'm going to explode and just, like, do something irrational, which scares me. I don't know. I'm a basket case, bottom line. Like, I am not emotionally stable, and I need help. I need a diagnosis. I need somebody to say, this is what's causing that. This is the reason you feel that way, and this is how we can fix it. But doctors take their sweet ass time getting a patient in. And I mean, I promise you, I could call a doctor's office right now and say, I'm losing it. Please, God, help me. Get me in soon. And they'd say, you either need to go to a mental hospital or you need to just chill out and we'll see you sometime next month. I mean, the healthcare system is broken because if you go to a mental hospital, as I've stated before, they are not equipped to handle mysterious diagnoses. My symptoms don't match up with any individual mental illness or even many combinations. The physical pain, the confusion, memory loss, all this, and the fact that it all started after a head injury, it all points away from mental illness. But when you call any doctor in the country and say, I am flipping out, they say you need to go to a mental hospital. But they can't treat me there. It's basically like a holding cell. It's like a prison. They pump me full of sedatives and put me in a room. And I know because I did this a few weeks ago. I was in there for 9 days. They pump you full of sedatives and put you in a room with a plastic mattress and keep you there for a week or so, and then they let you go. But then I'm still like this when I leave, so they did nothing to help me. So there's a lot of frustration there. And another reason I'm so hesitant to go to the emergency room, they come in and they go, "Where are you bleeding? Where is your broken bone? Your vitals are good. Where is the emergency? We don't see the emergency. Why the hell are you here? Get out." And even when you can schedule an urgent doctor's appointment, they're like, "You don't have a fever. You already have a primary care doctor. So why are you seeing me? Why are you here? Get the hell out of here." Nobody will take the time to listen to my story or to look for a potential cause for the symptoms. Everybody acts like it's not their deal, I mean, I even saw a psychiatrist in one of the emergency rooms, and she said, "Well, let's put you on antipsychotics." And then when I looked at my discharge papers, pardon my language, but it said fucking hallucinations. Visual and auditory hallucinations are what he's experiencing. And so her suggestion was an antipsychotic. I've never seen things or heard things in my life. I've never hallucinated. So, I mean, I take that back. I have bipolar disorder, and I had a manic episode once where I saw little sparkly trails of light. And that's about it. And that's not happening to me right now. I'm not experiencing any sort of hallucinations, but my discharge paperwork said hallucinations. See, this is how attentively the doctors listen. I was in the emergency room a few days ago. I got a phone call yesterday that said, it was a woman, and she said, "We wanted to check on your headaches." And I said, "What headaches?" She said, "You came into the emergency room for headaches, right?" And I said, "No, I came into the emergency room for severe neurological issues, memory loss, confusion, disorientation, severe pain in my head." So I guess, yes, you could call that, a headache, but it's coming from pressure that makes it feel like my eyeballs are going to pop out of my damn head. And like the pain goes down through my face into my jaws. I have muscle spasms, severe emotional instability. But if all of that can be listed under, basic headaches, sure, I guess. The point I'm trying to make, these are what the discharge papers have said that I have received. And I could actually pull them out. But I try to make these videos as short as possible because I know nobody's going to watch these if they're too long. I already make each one too long, I get the feeling. So I'm just trying to hurry as much as possible. Let's read some stuff here. All right. The first one, contusion of the head. The next one, brain injury / concussion. The next one, closed head injury. Okay. Now we're getting into post-concussion syndrome. I agree with that. But there have been no treatment established yet. And after that, here's where things started to deteriorate with my symptoms. Like I started to get worse. And they completely threw all that stuff out the window, the previous diagnoses. And they started talking about anxiety disorder, severe anxiety, anxiety reaction, agitation. I'd like to see what the papers from the mental hospital say, because I'm sure it says some total bullshit. If I remember correctly, it said something like, basically like putting down everything they could, like undiagnosed psychotic, undiagnosed emotional, undiagnosed anxiety, undiagnosed depression, undiagnosed schizophrenia, whatever. Just like they put down like a ton of different stuff. All right. I went to the hospital in Lincolnton, and they said the primary diagnosis, visual and auditory hallucinations, undetermined anxiety disorder, and severe agitation. And yeah, here it is. Main diagnosis. This was my last hospital visit. Headache. Yeah, okay. I hit my head, and now I'm going insane. What do we call that? Medical terminology. You have a fucking medical degree. And this person hits their head, and their personality starts to change, and they start to lose the ability to cognitively process information, and they become severely emotionally unstable. Oh yeah, sounds like a headache. I don't know. I'm sorry I'm so aggressive. I'm just really agitated, and I can't calm down, and nobody wants to help me. The doctors do not want to help me, and I am losing my mind, and I'm about to start crying, so I'm going to turn this off so the whole internet doesn't get to see me cry. Okay, bye.